Let's say a very good morning to Professor Karol Sikora, who is, of course, former head of the WHO Cancer Programme, Dean of Medicine at the University of Buckingham. Karol, a very good morning to you. Welcome.
Good morning, Mike.
Thanks very much indeed for joining us. We find ourselves once again at something of a crossroads, I suppose, because we're already getting this noise emanating from SAGE that, well, you know, maybe we're not quite doing enough. Maybe it's not quite working as well as it should. Maybe we ought to think about doing something more over Christmas. I imagine you're not particularly keen on that.
No, I was looking forward to family Christmas with my grandchildren from actually all over the world. And one of them is here, having Peru, but the others are not able to come here. And it may be a pretty bare Christmas for a lot of people. Well, I think it's terribly sad.
Well, it really is. And I mean, we all knew that they might try and sort of push the envelope a little bit more when they decided to shut down for the whole of November. But you know, you've got a piece of the Sun today saying why this 14-day isolation is not good for the nation, because you're talking about a Prime Minister who yesterday was telling us all how great the track and trace system was and how brilliant it was, proven by his getting pinged by the app, and proving it by staying inside isolated for 14 days, despite the fact that there's nothing wrong with him.
I know. It's, you know, you couldn't organise a brewery to serve beer. I won't use the usual.
No.
Better than this government has. It's just unbelievable chaos. And there's no logic to so much of it, whether it's banning tennis, banning golf, banning outdoor sports. And then on top of it, all the little things about, I mean, I can't understand the logic. I mean, I tried to go through the NHS track and trace, test and trace rules. It's impossible to follow and to try and come up with some logic. And people are following them like sheep. I mean, and we can't say anything in broadcasting to stop them because, you know, you have to obey the law. I can't say break the law, but the logicality isn't there. And, you know, you try and explain it to a grandchild rather than a medical student and you'd struggle.
Yeah.
Because it's not logical.
But that is the problem, isn't it? Because not everybody, for example, has downloaded the app. So if you don't have the app and you don't get pinged, then you're technically not breaking the law if you don't self-isolate because nobody's told you to do so.
Absolutely. There's no obligation to do it. And this idea of compulsion in society is something in Britain we're very proud of, our freedom, of our democracy. And in many other countries, the same. And they don't want to be told to do it. I don't mind listening to a rational argument and doing something if I think it would be good. But when there's no rational argument, and when there is this nonsense with Boris, he's supposed to have had COVID. Yeah. He's supposed to have had antibodies. He admitted he had antibodies yesterday. So why is he isolating? There's no medical sense in all this at all.
No.
Immune. There are 5 cases reported of people getting COVID twice, and that is it in the world literature. And let me tell you, COVID has been more seriously studied in the last 6 months than any disease in my whole time in medicine. Nothing's been studied so thoroughly.
And that's the other thing as well, because not only has he had it already, but surely the whole point of having a decent track and trace and testing system is that you use it in order not to disrupt work. You use it in order to continue to be able to work. You get a test, it's negative, you go back to work. Surely that's what he should be doing.
That's exactly right. And when you look at how it operates, the anonymity, which has to be there, has a downside. It means that you can't make the assessment yourself how close you were to someone. If it was working properly, it'd be working on Bluetooth and it'd be automatic, but it's not. We all know it's not working properly, and that the Bluetooth thing is neither here nor there. People are getting false signals when they're not even in the same room as someone that they're supposed to be their contact, because Bluetooth goes through walls, viruses don't go through walls. So it was never going to work. And then working on one set of smartphones, not on smartphones as well as it works on iPhones, this sort of nonsense. Surely this is the modern world. People that want to market something to you seem to get around everything. I get lots of spam. I'm sure you do, Mike, from people wanting to sell you something. Why can't we get a decent test and trace system up and running?
Yeah.
It makes no sense.
Well, I heard from a doctor yesterday on the show, Professor, and this will surprise you, who said that he has signed various certificates for people who have had negative COVID tests, and his signed certificates are being currently sold on the internet by people who have somehow managed to get hold of them. So, I mean, it's a very tricky world in which we live. I'm also told that the track and trace app works vertically as well as horizontally, so that you could be in a floor above somebody who apparently tests positive and you could get pinged.
Yeah, there's all sorts of things wrong. And, you know, the next thing that's coming where I can see rows, you've got the students coming up to go home for Christmas. We've also got the vaccine, and that is going to cause enormous problems. I mean, you know, in theory, it's a good thing. You have to agree, vaccines in the past have been a great thing. I have a bad feeling about this one. I have a bad feeling, not that it's going to do any harm, but it's going to cause political pressure and political debate, much great and more hot water and hot air than we've ever had so far about any vaccine before it.
Well, if you consider that there's going to be something in the order of 65 million vaccines needed just for one vaccine for everybody, you know, that's an awful lot of money, first of all. Also, you know, we've now got this secondary vaccine that we bought 5 million doses of. You know, 5 million doesn't go very far, does it?
No, there's 66 million of us, and if you exclude the children, and even if you take top priority older people, say people over 60, you've got a lot of people to get through. And, you know, there are two vaccines that have now look as though they're okay, but when we say they look as though they're okay, they've just had 3 months of testing, so you haven't got long-term side effects recorded. By definition, you can't have them. Then on top of that, we really don't know how long the immunity works. Now, if it's only a few months, then the vaccine is next to useless, because that means in the summer, you'd have to have the vaccine again. If, on the other hand, it lasts perpetually, like, you know, polio, for example, fantastic. The answer is probably going to be somewhere in between. And my bet, it would be like the flu vaccine. You have to do it regularly. It mutates a bit. You have to change the vaccine regularly. And you do get some side effects, nothing too serious, and there, of course, are going to be people that are conscientious objectors. They genuinely feel they don't want to have it. What do? Do you get the police to arrest them and hold them down? I hope not. I don't think so.
Well, I can't imagine that's what would ever happen in this country. But there again, you know, I wouldn't have ever thought that we'd be sitting here talking about a second lockdown, which may or may not turn into a third lockdown, which may or may not mean it's difficult for us to all have Christmas together. But, you know, you see some overzealous police officers operating in different situations in different places. But, I mean, Matt Hancock was on Julia Hartley-Brewer's show yesterday, refused to rule out you know, compulsory vaccinations, but I think even he was just not willing to be drawn into that conversation. But the government surely couldn't ever go down that route.
They couldn't, but you could do it subtly. For example, you could have to have it for travel. We put up with that. I went somewhere in Tanzania, and you had to have a yellow fever jab.
Yeah.
You had to have a WHO certificate. So we're willing to put up with that to do a particular thing. And it was inspected by the police when I got to the land border. Then the other thing we put up was occupational health. So all my career as a doctor, I've had to show every 2 or 3 years that I've got a certificate that I'm immunized to hepatitis because it's dangerous for patients to have it. And that's fair enough. And so I do it. So imagine if you made 1.4 million health workers, and you say you've got to have the vaccine, otherwise you can't come to work. Now I don't think that'll happen. I think we can get by this by persuasion. It depends, of course, on the results. It depends how good the immunity is and what it allows you to do, what freedom it gives you from what we're seeing with this oppressive lockdown.
Yes.
The lockdown might be crazy because no one can explain the logic for a lot of it.
No.
And there's no logic. Why are we doing this?
And also, if you can have, as the Health Secretary has this morning, Matt Hancock come out and said, yes, we can now test visitors to care homes because so many people have been deprived of seeing their loved ones and even being able to hold each other's hands. You know, terrible stories that we've heard here on Talk Radio of people whose elderly relatives have either taken their own lives or died in the meantime since they haven't seen them in March. And if they can do that now, why couldn't they have done it sooner?
You know, that is the question you have to ask. Why couldn't we have done it right at the beginning in April? We regularly go to my wife's got a fantastic great aunt, Auntie Toppy, in a care home in Lowestoft. Now, every 3 months we go up there on a Saturday, we take her out for lunch and so on. Curry house. She is unusual, and being 90, she actually likes a good vindaloo. And so
Brilliant.
I have to push myself to have this, but I take her out.
Right.
And we've not been able to go, obviously, since March, and there's no sign of it coming to an end. And she's got very few other visitors, and it would really be nice just to take her out. And not going to be possible. And a bit of imagination, and all people in care homes could have seen their loved ones, and everyone would feel much better because of it.
Yes. Well, I mean, I just spoke to Esther Ranson earlier in the show, who said that, there are certainly studies which will show that human touch and human contact is as important sometimes as medicine.
That's what we teach medical students now. It's all about empathy. It's a sort of empathize, and not false empathy when you're doing it just to show. But, when you look at customer care staff on airlines or in shops, they've got almost more empathy than some healthcare workers. And we need to get that consumer-based training within the health service. So right from the moment the receptionist greets you by your name, rather than just number 567, please come forward.
Right.
Things have changed over the years, and we are getting better at it. It's still a bit missing, and it's missing probably because we don't have time. The luxury of time, something that seemed to take place in general practice when I saw it on the television as a small boy. It doesn't take place in general practice today, as we all know. It's a hurried consultation. Often it's it's virtual, and it's often now not even with a doctor. It goes right down the food chain of professionalism to try and keep it as efficient as possible.
Well, I'm still hearing stories, Professor, of people who say they still can't go and see their GP. They still can't access a GP face to face. Everything is done virtually. The GP surgery is rarely actually open, and that needs to change as well, doesn't it?
It does. And the GP is the gateway to the system. And tomorrow, Cancer Research UK are going to release data showing that the number of people having cancer imaging, CT, MR, has dropped precipitously all the way through the summer, not just the first 2 or 3 months, but all the way through. And almost certainly, we don't have the data, but I suspect it's still below average for this time of year, which means we're still not diagnosing cancer, which is because the system is not fully open. And what you just said about GPs not being particularly fully open, not being able to get appointments, and looking like Fort Knox still, puts people off. It puts the older people. They don't want to be a trouble to the system.
No, quite. And as far as you understand it, is anything changing since you and I spoke, say, last about cancer treatments and about the numbers of people who are not getting treatment? Is it getting any better or is it getting worse?
It's getting better. There's absolutely no doubt. People have put a lot of effort into opening up diagnostic systems. They're still below what we'd expect month by month, but they are going up. And cancer operations, which are most people have some sort of operation, even if it's just a sampling, we call it a biopsy, radiotherapy, chemotherapy, the systems are all open all around the country. And they're not under pressure because the pressure is getting the diagnosis done. 1,000 people a day are supposed to be diagnosed with cancer, and we're still not at that level. We know that because you just count the number of people that have a positive biopsy, and it's not 1,000 a day. So we will get there. It takes time, but the system has coped. And I think the testing's there, things are in place. We isolate people for 3 days, tell them to stay at home after a negative test before they come for cancer treatment, as much for their own good as for the good of the centre to keep it COVID-free. So all these things are now in place. I mean, we're so much better off now than we were at the beginning of April, for example, when it was chaos and we didn't know how bad it was going to get.
Yes.
Now, not going to be too bad. It's this pressure, but we are going to get over this hump very soon.
Yeah, well, that's the other thing that I find interesting. I mean, Andrew Rossendale quite rightly pointed out when he was on just before the news that, the death rates, generally speaking, are more or less the same as they were for the past 5 years at this time of year anyway. So the fact that this lockdown is continuing seems to be kind of overdoing it somewhat. But also, by the time certainly you and I get around to getting a vaccine, it will be probably sometime towards the end of next year, at which point the coronavirus might not even be around anymore.
That's what I imagine. And by the time it gets around to me, some of my enemies might want to give me some nasty stuff instead of. But there's no doubt that the priority has to be the older people, the frontline staff, and then you go down the whole business. So you eventually have herd immunity from the vaccine. Herd immunity's got a bad name, as we know, but it's not a bad concept. The idea is you don't have to immunize or make immune, if they get it naturally, 100% of the population to protect everybody. You get to about 60%, and then the virus has nowhere to go, nowhere to infect, and it basically runs out of healthy bodies to infect. And the only problem is how long will the vaccine last for? And that is something we have no idea at the moment.
Yes, interesting times. Professor Karol Sikora, as ever, thank you very much indeed for joining us. Former head of the World Health Organization's Cancer Programme, Dean of Medicine at the University of Buckingham. Like me, somewhat sceptical about the worth of what this lockdown is going to produce at the end of it. Already, we're starting to hear noises from the old government scientists going, well, maybe it's not going to work. Maybe it's not working.